Maybe. Okay. So due to some technical issues, we have to start over again, but no worries. So I have with me Dr. Shifa Habib, and Dr. Shifa has been with us at AKU since 2022. And prior to that, she's had a vast experience in the field of public health. So again, Assalamu alaikum, Dr. Shifa, and I'm so glad that you joined in. So starting, so starting off again, I would just want to know, sorry you have to repeat yourself again, but what your schooling background has been.
Right. Thank you so much, Amna, first, because I'm really excited to be in. So I did up to my O levels. I was in the city school. Then I went to St. Pat's for my A levels. And back in the day, St. Pat's was quite a thing. And, getting into St. Pat's was a huge deal. And I see like now a lot of new A-level schools have emerged, which are doing really well. Then I did my MBBS from Ziauddin University. And Ziauddin was a lot of fun. I had a lot of fun, and I met a lot of amazing people.
What year did you enroll in Ziauddin?
So my matriculation year was 2004. I graduated from Ziauddin in 2009. It was December 2009, and it was just days before my wedding that I graduated. Honestly speaking, just a few days before that I got my result. And I think it was just very interesting. It was a roller coaster ride, to be honest, back in the day. Then I did my house job from the Civil Hospital Karachi, and the whole idea
nice.
was
Same.
Oh, you did?
Yes.
For me, like coming from a private medical school and civil hospital and I was like, I want to do public health. I've seen a lot of how things work in the private sector, and I want to see how things work in a public hospital. And that's where the real experience is. And you get lots of hands-on activities in a public sector hospital. So I think a lot of people just pep talked me into signing up for a house job at civil hospital. And honestly speaking, I don't know if, every step on the way prepares you step, and going to civil hospital really convinced me that it is because I had to come in public health, and it is because I had to completely convert from a clinical to a public health, route, that Allah Mia had to send me to civil hospital to get exposure to what public sector facilities look like and how they operate and how they function and what are their gaps and weaknesses. I think that 1 year was life-changing for me, not only in terms of getting motivated to do public health, but also because I think there was a deep realization that some things need to change at the systems level for our health outcomes and health indicators to improve. It was mainly the health systems that had to be interventions had to be guided towards addressing health system gaps. So I was like, there are a lot of doctors. They're all gonna see individual patients, and they'll all do really well. But how about I try to address the systems level gaps? And that was life-changing for me, that experience, because it was so horrendous. I learned a lot. I was repairing hernias on my own, and I was doing but by the same time, I think I got exposed to a lot of gaps in how the health systems operate in Pakistan, and that completely made me change my mind. I gained a year of experience in public health, working in a micro health insurance organization, which goes by the name of Naya Jeevan. And so I worked there for a year, and then I started my master's at AKU in health policy and management. And I've never looked back.
Amazing. That's quite a journey. So if I pull back a little bit, you said that after you graduated from Southern, you had already decided that you wanted to do public health, and which is why you did your house job in civil. So why did you change or make that decision before you graduated even? Or
So
how,
honestly,
rather?
I think it was during the early days of my house job that I made the decision. When I graduated, I think I was really interested in doing ophthalmology, and I started my house job. So when I started my house job in surgery, so when you do 3 months of surgery and 3 months of allied, I was like quick to pounce upon ophthalmology, and that's what I really wanted to do. I was posted in the eye ward at civil hospital. So it was during the early days of my house job that I decided to pursue public health for all the reasons that I just mentioned, that, there are just so many gaps at systems level that, how do you start treating patients when you do not address uh, all the gaps in the health systems? Where do you even, treating one patient is fine, but when you're looking at the health of communities and populations, you really need to, your interventions should be targeted more towards health systems.
True.
So I think that realization came very early during my house job, and I completed my house job, and it was a roller coaster. However, soon after, I think I moved towards public health within days of finishing my house job.
Interesting. So you probably finished your house job around 2010, I'm assuming 2000, starting of 2011. So at that time within Pakistan, मतलब public health का उस time पर क्या scope था? Because I mean, I'm speaking as a person who did my house job in 2020, and at that time when I would say public health, people would still be like, अच्छा ये क्या होता है, मतलब तुम डॉक्टर नहीं हो अब, so I'm just thinking like 10-13 years ago, it probably would have been worse, like the reaction that you would have gotten.
So, Amna, this reaction that you're speaking about, I still get. So when you're in family weddings and people want to know what you're doing, you're like, oh, I work at the Khan University, I'm an assistant professor there. And okay, so the question is, you work at Khan, do you see patients? Which department you work in? I work in community medicine is my answer, community health sciences. Okay, so are you in the management side? It's like, no, not really. I'm not in the management of the hospital either, and I don't see patients either. But it takes it. I think the way I explain to people, that I looking at examining patients, treating, managing individual patients is a micro level job, which in itself is hugely important, of course. But what I do is more of a macro level work where I'm looking at how beyond the health of individuals, I'm looking at the health of communities and population. So this is one way of how I explain to people. And so it's not about, I think this reaction I still get. But, I'm just trying to even, you get a lot of reaction from family aunties saying, oh, tum practice nahi karti. So my common answer response to that is, मैंने practice बहुत कर लिया है और मैं अब real match खेल रही हूँ, net practice बहुत हो गई है. So I know public health in itself, especially for physicians or doctors who've converted to public health, it's hard explaining to people in terms of what you're doing and what your job description is. But eventually, I think what you're doing is amazing, because you're trying to kind of raise more awareness about public health, and especially for the new entrants. So I think they'll all learn from the different experiences that we all shared in terms of, how we managed to respond to all the questions around the scope of public health and what we do when we were new entrants into the field. I think now we've become pros in answering these questions. They don't even bother us anymore. Like, you know what? Just we're killing it in public health, so don't bother knowing. It's fine.
True, very true. Interesting. So, so after you finish your house job, and you had immediately decided कि बस अब मैंने इसी में ही जाना है. So then you said that you started working at an NGO, Naya Jeevan. What can you give me a little bit background what that was about, what your role there was as a new intern?
So I was the preventive health manager, and to be honest, the first most interesting thing about that job was my salary. So back during my house job days, my house job was entirely voluntary because I was a private sector. I was from a private school,
Yeah.
gone to work in a public hospital. So the number of intern or house job seats they had are only reserved for their own graduates from like Dow, etc. So I had to do my house job on a voluntary
Yeah.
basis, on a pro bono basis, where I was not getting paid. It was fine because I think the others were getting paid 10K. So the salary of house job, salary of house officers back in the day was 10,000.
So not much of a loss.
Yeah. So, but then goes that 1 year, I start my job at Naya Jeevan and I'm offered an initial salary of 50K. And in 2011, 50K was significant. So, I mean, I'm not talking, right now I'm speaking like my nani or my dadi usually used to speak, oh, उस ज़माने 5 रुपए की अहमियत होती थी, but उस ज़माने 50, so this is
It
about.
still is, because even now an entry-level job is, you're not getting much more than that. True.
I was the preventive health manager. It was basically, it was a very interesting concept. It was micro health insurance where, you could provide insurance to your domestic health. And so there were a lot of, because it was just micro plans with about, having to pay about 200 per person per month. You are able to provide some protection against catastrophic health costs. So I think that entire concept was amazing. And I think this is where my interest in health insurance really started. And just recently, I was very, very fortunate to have been part of the third-party evaluation of the Sehat Card Plus program, which is honestly, that program in itself is it's an example how a low middle income country who's struggling with its finances can still manage a publicly funded health insurance program. Anyway, going back to Naya Jeevan, I think so. So I think as I was the preventive health manager, where we were offering value-added services to the beneficiaries as well. So I'd, take their calls on the helpline. I'd go and examine them once in a year. I'd deliver public health lectures. And, there was an entire preventive health team, which was headed by a Fulbright scholar who had graduated with an MPH from Harvard. I think, and also, in that team was also Dr. Sara Salman, who is currently the WHO head of the Sindh office. So I was very fortunate to have been in the right team, the right people who really guided me on my journey. And the next thing I know, I was applying to, I worked there for a few years. I realized the potential that public health really has. And I was applying, next thing I know, I was applying for this program at AKU. And honestly speaking, I teach in this program now, but this program has been life-changing for a lot of people, and I really encourage people to apply, public health aspirants to apply for the program. Yeah.
Amazing. So like so, the conversations I've had with other people also, जो ये छोटे-छोटे, not, well, this is not small, but it's like, even when you don't know what direction to take exactly, like what masters to pick up, experiences like this really do guide you and kind of define your path. Which brings me to my next question, which I think you partially answered also, is knowing कि अच्छा ठीक है मुझे I need to go into public health, but then knowing what track to go into public health, right? Which is something that a lot of people are confused by. Which is why an MPH sometimes ends up being the degree. Not to say an MPH is an inferior degree in any way, but because it's a more holistic degree. But choosing a track where Kacha, I want to go into policy, or on the flip side, when people go into epibio, because unfortunately within Pakistan, we don't have a lot of options for the different tracks you can go into public health. So, I think maybe working, I don't know, but did you know that health policy management was the track that you wanted to go in prior to joining Naya Jeevan?
Right. No, not at all. I think for me, it was a very last minute decision as well, because I was confused, as and like many others, as to which track to take. So one of my friends who was there with me in St. Pat's, and then at Ziauddin, and then also worked with me in Najivan for some time, and I was having a discussion, and he was also a public health aspirant. Unlike our other friends, we were having this conversation, and I discussed it with him, and he mentioned. So he explained it to me in a very simplistic manner. He's like, listen, if you want to be very sound technically, if you want to know the technicalities of how epi works, or in terms of how public health works, you take the epi bio track. If you want to learn, if you want to be very technically strong, but if you want to be a leader, and if you want to be in a prominent position, if you want to then do policy and be in a health policy and management track. So I think when he explained it to me in a very, while I would love to be more technically sound and know all my statistics and all the advanced statistics, I think I was very for, and I chose health policy and management track, and I don't regret it all. I think even now, when I was choosing, it was basically the same decision. I'm sorry, and I'm kind of taking the conversation forward without unsolicited, some unsolicited comments. But I think right now, when I also had to choose my track, PhD, for choosing between a PhD and a DrPH, I kind of had to make the same decision. It was the same that I made back in the. So I think I'll come to that when you ask me your next questions. But yeah,
Sounds good. So, so your master, the 2-year masters, how did you? I mean, the only reason I asked this is, even when you're going into any program, you kind of have to develop a thesis, and the one way of developing a thesis is कि अच्छा ठीक है समझ नहीं आ रहा क्या करें, whatever is more feasible to do, let's do that. Another way of developing a thesis is, okay, this is what I want to work on in the future, so I'll start off small on my thesis and then build up on that. So what was your journey like?
right. My journey was definitely the latter one that you mentioned, that I knew that what I wanted to do. So I think I knew I was working at.
Yeah.
Okay, so we were talking about my thesis, and so my thesis was on, I think I've been able to publish it as well in BMC Health Services Research. It was on the willingness to pay for health insurance among low-income households in Karachi from the perspective of females. And I think this is health insurance is something that I've been really passionate about right from the beginning, that, from the time that I was working at Naya Jeevan. And I have always been very passionate about finding sustainable health financing mechanisms for, low middle income countries. So I think, and now recently I've been involved in the third-party evaluation of Sehat Card Plus program. So I think health insurance is something that's very close to my heart, and I'm so glad that Pakistan's moving in a direction where, these are these publicly funded health insurance schemes that are improving financial catastrophe, improving health outcomes. It's too early to say, but definitely improving the financial risk protection and access to services. So while we don't have this scheme in Karachi, but I think in Karachi, because in Karachi or other urban areas where you see a lot of where there are different financial tiers, households belonging in different financial tiers, I feel like some people who can contribute towards health insurance schemes can actually contribute towards a prepayment mechanism in a community-based health insurance scheme or a state-funded health insurance scheme, which is co-financed by people. So I think even when you look at sustainability of these larger health insurance programs, such as Sehat Card Plus program, I think from sustainability perspective, it may in the long run become more sustainable if some part of it is co-financed by the citizens who can afford to pay. So I think my thesis was stemming from there, the willingness to enroll and pay for health insurance schemes. And this is the kind of work that I think I've also carried on later. And I'm still a part of this, the project that's looking into sustainability frameworks for these publicly funded health insurance schemes.
Amazing. And I will definitely, so I have a brief idea because, you guys have shared the work that you've been doing during WRPs. And so later on, I will definitely bring this up because it's very interesting. So you, after you did your thesis, which, you built up on, my question in terms of when you're doing a master's program is how important is it, and not just during an education program, but during a career growth, especially a career growth public health, how important is it to have a mentor? Because I know that you had one. So that's why I want to know that, do you feel like that made a massive change in the trajectory that your career has taken?
So I think I've been very fortunate to have been mentored by different people in different stages of my life and different stages of my career. So it's not been one person who's actually guided me throughout, but different people. Like, for example, I think during my master's, Dr. Shaila Zaidi, who was also my supervisor, and my current boss, I think she was amazing in putting me on track and really supporting me through my master's journey. Then later on, I started work in as a manager research in CHS, Community Health Solutions, which was a sister concern of the Indus Hospital, and it was basically the implementing arm of for the Indus TB program. And I think there after like a year and a half, I was promoted to the head of M&E from a manager position. Within a year and a half, I think I was promoted to a head of a very, very major department, which is M&E, for a project that has a huge funding from Global Fund for AIDS, TB, and malaria, and it's spread across 24 districts. I think that was it was a huge deal to be and I had a wonderful team to work. Pushed me into becoming. I was obviously a manager. I was a fresh graduate, ek saal kaam kiya, and I think he was definitely behind the big leap that I took there, and I never looked back. And even during the time, because it was a very, very high pressure situation, GFATM, I think people who have worked with Global Fund would know that they're not easy donors, and being sub-recipients in this hospital, there are a lot of monitoring and evaluation issues that came up, and was a very high pressure job. But I think he was always instrumental in motivating me to do my best and to actually always stand up for the right. Because, when you're doing M&E, it is sometimes your own team members, in terms of your people in your own organization. You may not be, because when you're monitoring operations of an organization, you're not the most favorite person in the organization, right? Because you're keeping a keen eye and monitoring the activities, what's happening in the field, what's happening on the across the 60 static centers and across the 23 mobile lands. You can't be the most favorite person. Where he taught me, you're not here to be liked by people. We don't want people to like you. He's very clear on this. People like you, you're not doing your job right. So we don't want people to like you. So I think he played a major role in, and I think giving me that attitude where I don't care if people don't like me, right? I'm here to do my job. I'm here to reach to a position. In on the way, there are always going to be people who will not like you, and it's okay to, you have to learn to live with it. So I think he gave me that attitude where I'm like, it's fine if a few people don't like me. I have to be honest to myself. I have to be honest to the job that I'm doing. I have to be honest to my employers. And end of the day, there will always be people who will hate you for doing well or doing your job right. So you have to learn to live with that. So that's mentor number 2. And then obviously coming back here, I loved working with Dr. Samin Siddiqui. And I think I also mentioned in his farewell dinner that, जब वो डांटते भी थे तो मुझे लगता था कि यार no, I want to hear it again. उनकी डांट भी इतनी अच्छी लगती थी कि मुझे लगता था कि मुझे थोड़ा सा please और डांटें, this is not enough. when I discussed this with him, and he was like, मैंने आपको कब डांटा है? I was like, maybe the few times that you did, because sometimes I was working where he was the PI, and he thought that I would make like decisions on my own without consulting him, whatever. He had that, and sometimes I'd also land in trouble making quick decisions, but every time he would just make that reprimanding also such a joyful experience that I think it was wonderful working with Dr. Samin. And again, Dr. Shaila, there's a lot. I think she's a maestro of policy. And there's so much. The reason that I'm able to stand and teach my students policy is because I have been taught by her, and she's there to completely support me during my course. So, and also I think one individual I'd really like to mention who's supported me in very unusual ways, and is Dean Adil Haider. I think he's been so kind to me, that sometimes I feel like he just makes me feel like I'm so welcome at AKU, and the AKU is so fortunate to have me, which is not, I'm sure, not the case, because AKU is like a whole institution in itself. So anybody who's at AKU at a good position is very fortunate, but he makes it sound like AKU is fortunate to have me, and that in itself is such an ego booster. So I think I'll give it to him. Also, one more person I have to mention is Dr. Rashida Farand from LSHTM. She's authored a few papers with me, but she's always been very, very supportive. And the entire, I think, motivation behind pursuing a doctoral program when I thought I was doing very well in the industry, I think a lot of the motivation was coming from her. So over and out, back to you.
Very nice. No, this is, it's nice to see that multiple mentors or not mentors, but just people you can take guidance from, rather than kind of just working in your own corner and trying to progress through that. But I like this approach that, you take advice from multiple mentors and you kind of keep them on board while you're going ahead. So coming back to the work that you did with the TB program, and, as you mentioned, that there was a lot of M&E that was involved in it, and there was a lot of liaising between the funding agencies, and I'm sure there was a lot of coordination between the different provinces and the provincial governments. So how much would you say that the degree that you did, how much of the work that you did within your work with the TB program, how did the master's program help you, and how much of it was learning on the job?
So I think the most important thing that the degree from AKU gave me was credibility in the market. When you have AKU, a degree from AKU against your name, I think you automatically are seen and known. So I think that credibility was very important for me to move forward in my job. Apart from that, I would say it was 20% classroom learning, as in 20% was application of what I learned during my master's, and 80% was on-job training. And I would say that eventually, whatever degrees you have, wherever you go, they can only get you so far. Eventually, it all comes down to the person that you are and how well do you work and how honest you are to your work. So the degrees, while they're absolutely important, like the degree at AKU really gave me that credibility in the market. However, eventually it can only take me so far. Any degree for that matter can only take you so far. It eventually comes down to the person that you are.
That's very true. Very true. And so you joined, what year did you join the TB program?
I joined the TB program in 2016, July 2016.
And
January 2018, I was 21 before joining AKU in July 21. July 21 is when I joined AKU.
right.
And I think every after a few years, gained tremendously in that program. I think I knew that I had to come back to academia at some point and learn more. So I just wanted to start my doctorate. And for that, I think I just wanted to reconnect with academia, and what better opportunity than going back to your alma mater, going back to your home institution. So there was an opportunity, I was approached for it, and I took it. But everybody has a very different journey, and also depends on the goals and objectives of where you finally want to be. But I think for me, it was very important for me to spend some time outside of AKU, about 5 years. I was actually approached for some roles within AKU after I graduated, both an instructor, senior instructor, right after I graduated. And I had applied for those positions. However, the HR process at AKU was so slow that during that time, I was offered another job and I accepted it, and I never looked back. But I think I would suggest that everybody should spend some time outside of AKU to really see how things operate outside the red castle. It's amazing. This red castle is amazing. It's beautiful. It's amazing, and but it's also highly regulated. So sometimes it's good to expose yourself to a very unregulated environment where you're on your own and you're just swimming in really rough shores, not knowing where you're going, but you're going. So we should have like a different, like a taste of the outside environment as well. I'm sorry, my throat is a little bad today, but
you're doing great. Amazing. So I know that you're also like you mentioned that the thesis work that you did on was on insurance, social insurance, but I know that you're also very interested in infectious diseases, specifically that has also in TB, malaria, HIV. And so as a public health professional, we have this kind of I would say the perk that we have is that we don't have to confine ourselves, to certain boxes. So I think that's very like the work that you have done within the role of within the field of TB Once you started working at AKU and you were doing monitoring and evaluation over there, and once you started working here, the projects that you started working here, how much of your experience working in the developmental sector, how did that translate once you came back to academia?
Right. So I think the experience that I gained working in the industry was invaluable. I think that experience I apply on every step of the way, whether I'm teaching policy. I think when I'm teaching my students, I'm always giving them examples of how these different donor agencies work, how the whole funding mechanism works, how the global health initiatives work. I think it's because I have that experience. And secondly, I think what I was while I was working in TB, I was mainly working in a private sector engagement model. I think that model we're also doing now with our EPI program. So I think while I do not, while I absolutely love TB, I've not limited myself to TB only. I'm able to apply the same learnings to different projects. And so I think gaining that while that experience probably may feel a little disconnected from academia, but I think because it was such a diverse experience, I feel like the learnings I'm really able to apply not only while I'm teaching my students, but in my other projects as well.
I the journey that you have told me about, like I'm really enjoying every single aspect, because I feel even though it's been diverse, every part has been very linked and connected to each other. So I think it's around 6:50 now. So let me jump to my last question. And my last question is, so in 2023, as a person who is thinking of going into the field of public health, whether that be a doctor or anyone with any kind of background who wants to go into public health, in Pakistan, what do you think is the scope of public health, in the sense, like, I know that there's a lot of work that needs to be done, but I also feel like there isn't a lot of market demand for public health researchers or public health experts. What do you, or would you like to shed some light on that?
So I think I do not necessarily agree with it about the demand side. I think AKU is creating different programs. Now there are AKU is already running 3 master's programs in public health. And there are 2 new programs that are emerging. I think the demand is not drying up. One side of it is within AKU. I feel like with all these different programs coming up, there'll always be need of people to teach them. So one is that. And then obviously the grant portfolio at AKU is huge. So the research that's happening in public health research, and not only with CHS, with the Department of Community Health Sciences, but the public health research portfolio of pediatrics, of medicine, anesthesia, these are also very huge portfolios. And so there's always work happening there. Other than that, I think there's a lot of scope outside as well. So not only so there obviously there are a lot of INGOs, and and on top of INGOs, there are very, very good local NGOs as well, which are doing great work. I think what Afan does to you, and I know this session was not because I could sing praises of AKU, but I think what AKU did for me is that it put me in touch with the right people who are who are actually in the industry, who know what's happening. So it's very important to make the right connections here. Use your time for students who are at AKU, for students who are planning to come to AKU. Use your time to make connections here, because bond with people, bond with the faculty. They're all coming, they're at their position because they've they've done something, or they've so make connections, network well. And I don't think there is a paucity of jobs in the market. It's just about playing your cards well and knowing the right people. But the one thing that in my experience is that it's, while public health is a very closed field, so it's, you know, everywhere you go, you'll see the same faces sooner or later. But it's important to keep your connections strong. So while you're at AKU or even in your other job, make sure that you keep your connections strong, because the word of mouth travels very fast in the field of public health. So if you have that good reputation, a good word of mouth regarding your skill, abilities will go a long way.
Makes sense. And sorry, one last question, Dr. Shifa, which I missed asking you, which is a kind of a big question, is we didn't talk about your PhD process, or rather your DrPH process. So my question to you for that is, when we go into academia, the PhD is what you keep on hearing, right? DrPH is still a relatively new term for people. So can you explain as to why, instead of doing a PhD, you decided that you wanted to go this route?
So I remember my friend Mufaddil, who had actually helped me choose the track back in when I was choosing tracks for my master's. And he told me that if you want to be in a leadership role, it's HPM. If you want to be more technically sound, it's EpiBio. Because back in the day, I think AQ was offering these two programs. I think it was pretty much the same debate here. So DrPH, the program that I'm currently, so it was basically a PhD. Everywhere you hear, you know, like you mentioned, it's PhD everywhere. Not a lot of people are even aware of the term DrPH. So it's a doctorate program in public health, which is equivalent to a PhD. However, it has greater emphasis on practice and policy. Like PhD is more, I think, focused on research and developing those research skills, which will probably prepare you for a career primarily in academia. And not that it's only in academia, you can shine anywhere, but the primary skills that you will acquire during the PhD program is that for conducting sound research. Whereas DrPH will prepare you for a career in public health practice or public health leadership. For example, the program that I was very fortunate to have gotten into, which was at Johns Hopkins, I think there's a lot of emphasis on leadership. And I tell you that we prepare you for public health leadership. And everybody has a very different, so I think it just kind of occurred to me again that no, this is what I want to do. I've always been more inclined towards leadership roles. And while there is a huge research component as well as a research degree end of the day, but you know, there are about 64 credits that I have to complete, which mainly comprise of a lot of management, leadership roles, based courses as well. So I think this is where, so I think it took me, and my main issue was that, you know, eventually people will call you a PhD, you know, it's fine. That has its own, but I think it'll still take some time for the DrPH to become a commonly used terminology for the program, for the kind of program that I'm doing. So it'll take time for the DrPH to get mainstreamed. However, I think let's see how, you know, I've just only started it. So let's see, you know, how much I'm able to gain out of it.
And so what track have you taken in your DrPH?
Policy and evaluation.
So continuing.
Yes, I'm continuing. So obviously policy is something that I teach. And I think for you to be an effective leader, it's important for you to translate your research into policy and practice. So policy is coming from there. Evaluation is coming from a lot of my experience, not only as the head of M&E in a very large TB control program funded by GFATM, but also, the recently conducted, I think I have a keen interest in conducting evaluation of public health programs. And Sehat Card was one such experience, which was amazing. But I think I'm going to continue on that track.
Amazing. Thank you so much, Dr. Shifa, for giving us your time and sharing your amazing journey with us. And I'm sure that all the advice that you've given us within this 40-minute session, I am sure people will take it and put it to the practice within their own careers. We have one last question, I think, from Samra. And we'll take that, if you don't mind.
Yes, please.
So Samra asking, how much time should one spend getting work experience? And when is the right time to do a master's?
So I think masters, you should start, I think, about a year after your bachelor's, whether it's an MBBS, PDS, or any other program. After about a year and a half should be enough for you to before you can go on to your master's program. And so, but after your master's, I think you should spend a few years before you go on to the next level and plan to pursue your doctorate. So you should after your master's spend a few years working, whether it's in research, academia, whether it's in the on the implementation side. But this is how I see it.
Amazing. Thank you again, Dr. Shifa, for taking out the time while being sick.
So I think I'd really want to appreciate all your efforts. I think it's always fun speaking to you off the record and on the record, but also the fact that what you're doing to promote public health is truly mind-blowing, because like you said, a lot of and you're obviously working out of your job description to promote public health among masses and this career track, which still I think is not very mainstreamed. So what you're doing is incredible, and you have all my support and best wishes.
Thank you so much. Thank you so much, Dr. Shifa. And with that, we will end our session, and Hafiz.
Hafiz.